Are you suffering from chronic joint pain? Do you need some advice on how to handle it or how to get it treated? Well, today we're getting answers. Dr. Raymond Doll from OIP is here to help today. Joint replacements, not just for seniors anymore, huh? How has that population changed?
Well, we have people exercising and playing sports at an earlier age, and many of them can suffer ligamentous injuries that would set them up for arthritic hips or knees in the future. Also, we have an aging population with the baby boomers, and they want to maintain a healthy, active lifestyle. Sure.
Well, then what is your advice to folks like that who maybe are struggling with this chronic joint pain, but they do want to return to a more vibrant lifestyle?
Well, I mean, let's face it, arthritis certainly makes all of us slow down, but there's no reason why you can't continue to participate in sports and exercise. And with any treatment program, diet and exercise are very important. Exercise helps with flexibility, range of motion, as well as strengthening. And in patients that are having chronic hip or knee pain, they would be a candidate for joint replacement, and the Mako-assisted robotic surgery is at the cutting edge.
You know, when somebody is presented with that scenario of like a knee replacement, a lot of folks are like, oh my gosh, that's not, I don't want to do that, I don't want to do that. But there are so many advances that are making this easier, recovery easier, and one being what you just mentioned, that Mako robotic arm-assisted surgery. How does that differ from a traditional approach to like knee or hip replacement?
Well, the Mako robotic assisted surgery is indicated for total hip, total knee, and partial knee replacement or unicompartmental arthroplasty. What happens is the patient will be sent for a CT scan, and then we get a 3D reconstruction of their bony anatomy. And what we're able to do is individually have a preoperative plan that tells us exactly where the implants, the alignment, the orientation for those implants would go for that individual. And then in surgery, the Mako robot helps us to execute that plan precisely.
Isn't that something? And what are the benefits to the patient?
Well, I mean, early on, what we're seeing is patients are obtaining range of motion quicker with total knees. We're seeing that their need for narcotics is less. And I think we're going to find in the future that the robotic technology is superior to our traditional techniques.
It must be fun for you as an expert to be able to see all this new technology emerge and be able to put it into practice.
Oh, absolutely.
Yeah.
It's kind of like a video game.
Very good. How can we get more information? How can patients learn more?
Well, they could certainly come see one of our providers at Orthopedic Institute of Pennsylvania. We specialize in all musculoskeletal care.
Very good. Well, thank you so much. Really interesting. Good to have you with us. We'll be right back.